My name is Tony Gillespie. I am the Vice President of Public Policy and Engagement with Indiana Minority Health Coalition. And that is a long title just to say that I work with, I represent the agency in legislative issues with Indiana legislators, with federal elected officials, and I, along with my team of staff, one staff now, and interns, help shape the policy agenda for Indiana Minority Health Coalition and our 20 plus affiliates that we fund around the state. You know, the academic side is, you know, proactive, and I'm headed down the line. I can see tenure, or I want a position here. And for community, these are people who, once all of the meetings and all of the excitement goes away and you are graciously part of an article that's published, you go back to the same community with the same issues. And so I think what sets our projects both apart and on fire is that people go back to their community having been part of this process, and then they go back with ideas and skill sets that they try to, you know, do something else at the project level. They go to the city and say, hey, we participated in this project and these are the issues, how are you going to help us fix it? And so it just gives everybody a piece that they then go back and do something different with. It just keeps giving and keeps giving and keeps giving. So I think that's what community research is supposed to do. And I think that that's what good partnerships are supposed to do. You know, I'm sure that there are people who participated in those studies, and there were a series of them, the Secret Shopper, the Community Health Center study. I know that there are
over-the-counter testing study, that was a blast.
Over-the-counter testing study.
I know.
And people who participated who then ended up presenting in a workshop at the CDC that I'm sure they didn't,
I love that.
They didn't bargain for. So I know those people are still making reference to those projects.
Yeah.
Even though from an academic perspective, they're old, they're dated, it happened, it's archived, it's posterity, but you know, for them, it's still real and living, and that's exciting. It had been a decade that the State Department of Health had done a needs assessment of any kind around HIV prevention. And prior to that, there have been smaller studies that have been funded here and there. But one, there hadn't been anything done in more than 10 years. And two, nobody knew where any of those studies were. And in that plan, we miraculously pulled together all of the past HIV studies that have been done, large or small.
Yeah, that was a haul.
That was a haul. And we put them all in one place, and then we did this incredible plan about how we wanted to move forward. Because I certainly didn't have a good relationship with community planning or the state, you served as the conduit to bring all of those pieces together to make it happen, and you were the trust agent there.
Really? Wow.
The Department of Health didn't really trust IMHC because there had been a tumultuous, rocky past with, you know, us having to go to the legislature and say, hey, look, the state is not paying attention to minority health, which was true at the time. And so you were truly the neutral one in that process and the convergence of all of those pieces. You helped make that happen. That's why the HIV division definitely trusted the process to create that. Had it just been IMHC and some other random PI doing it, wouldn't have happened.
Well, you know what I really loved about that process, because that started kind of the way we all kept working on all the rest of our projects. I just remember all this paper all over the walls in your conference room, and the coalitions came in, and then people from the CPG, the community planning group, came in too. And we looked at all the studies and broke them down for, okay, so what? You know, you found X, so what? What's missing? And I remember people writing with crayon and marker all over the walls. And I'm really glad, because my worry at the time was, you know, would people feel intimidated by all this stuff? And they weren't. And we simplified it all together so that we had talking points that were heavily, it was just heavily rooted in evidence. And that was such a great experience. And it really, I mean, that agenda, we actually published a research agenda that became
You
our
did.
HIV
You published research
prevention
for it.
agenda. And man,
Mm-hmm.
I love that, because then we went and did our secret shopper study of testing sites from that, and our
Well,
community health center from that. I mean, everything drove out of the
right,
plan we did, which I loved, because it just,
right. We
anybody could
did
do
a
it. Didn't have to
plan,
be us.
and we did it. Well, no, not anybody could do it. No.
Oh yeah.
No, 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 no. Well, okay. Anybody could have done it, but it wouldn't have been the living document and a true guide, because
Mm.
people create agendas all the time, but
Oh yeah.
the strength of the agenda is to follow it. And so
Hmm.
years later, what, 3, 4 years later, we were still referring back to the agenda that we created.
Yeah.
And I mean, that's not, I don't think that's typical.
Mm.
That's not atypical in research. Even if you get funded for a second or third year at a research project, it's not always typical that the original PI will follow and make the other pieces happen.
Mm. Mm.
Um, and so that was the incredible strength, and where it made the partnership, I mean, work beyond a shadow of a doubt, is, so our work is coalitions, building
Yeah.
coalitions around the state, and following the recommendations of our coalition in whatever community they exist in, versus the statewide agency thinking they know the entire state and um, make decisions for the state. I think that very much is traditional research, where you go into a community and you do research to the community or research for the community. The participatory research model requires that you conduct research with the community, that you
Hmm.
build your research engine with the community, and not some pieces of it you build and they accept it. You build it together. Where it wouldn't have worked with another PI because that is your commitment, you never once considered some other version of it. So it wasn't a struggle to get coalitions and partners to participate, because that's how they've been oriented. So here we are doing a project that facilitates that, but you
Hmm.
never even considered what the alternative would be, or you never considered moving forward with any piece of it unless community was part of it.
The group together helped us develop this method that I use now, even
Mm-hmm.
years later, which is community as interviewers and actually researchers. We had the task of evaluating HIV testing because we didn't really even know who was reached. And then when we sat down together with the coalitions that you had gathered for the meeting, people really, we kind of got just chatting about it. And it was like, well, secret shoppers the way to go. Well, we
Mm-hmm.
need to look like the community that's at high risk. And that was, I mean, the recruitment effort that went into that
But see,
statewide thing, that was
you know,
awesome.
that's a great example. So part of the process was to have community inform us on what we're going to do.
Right.
That's non-traditional. And
Mm.
the power in that was, then we had a room of people who made the decision versus the researchers making the decision and then retrofitting the people to be part of it.
Yeah.
And it was so strong and so powerful and so productive and so revealing. Because what we found out was that a large number of a huge failure rate in people being able to access HIV testing
Yeah,
around the state.
20%, 1 in 5
20%.
couldn't get a test. Yeah. And then we
20%
wrote a
couldn't get a
paper
test.
for that, which I know that it was, it may not be as helpful for communities to have a journal article, but it allowed us to speak to the legislature, that power of a citation, that we could say,
Right.
this is what's going on.
Right.
You know what else I loved about that project? And again, it kind of really gets me excited about the work that we do at any time together or other partners too. And that is the people who were involved in the project and their recruited partners who then became the secret shoppers.
Mm-hmm.
They were so interesting as people, their life experiences that they poured into this project. And I remember one person in particular who had just gotten out of jail, and her mentor was one of the people that was on our original committee, and he
Mm-hmm.
had brought her in. And I'm giving her a ride. So we did our training, for the process, and I'm giving her a ride back home to her house. And I said to her, well, how's it going? I mean, tell me about how this is for you. And she's like, no one ever listens to me. I work at a bowling alley. I just got out of jail. I'm living in a halfway house. And you want my advice? You're actually wanting me to tell you how I should
Right.
do this, how we should run this. She's
Right.
like, who does that? And so, I mean, at the time I wanted to cry. She was as young as it could have been my daughter. And
Mm-hmm.
here's another thing that came out about that was a year or two later. And I had said this to the secret shoppers. I'm like, you guys ever need a record of, letter of recommendation or whatever? Cause you were researchers, you were
Right.
field researchers.
Right.
And so she asked me for a letter of recommendation for another job. And I gave it to her, and she was surprised I gave it to her. And I'm like, no, that's the way this works. And, because I would go to my people I've worked with and ask for a recommendation. I bet you've written letters for me. And she got the job. And so I think about the outcomes of that work together is more than the findings, which were really, as
Exactly.
you say, groundbreaking. One in five failed. CDC was really interested in that. And, it allowed our state to start working on the testing sites that weren't working for the people. But I think the process itself I felt like it was valuable to the people involved. And that to me was almost as meaningful as the findings.